And now we're going to bring in psychiatrist and author of High Functioning, Dr. Judith Joseph, for more on the fascination with the suspect. Dr. Joseph, thank you so much for coming on. And obviously we have this conversation sending condolences to Brian Thompson's family. But we're talking about the response from many people on social media that does not offer that and seems to almost be, as you have said in a social media post, you're calling it callous. That's how a lot of it appears. There are 112,000 laughing emoji reactions on a Facebook post from UnitedHealthcare parent company to a man being murdered on the sidewalk in Manhattan. Why are people having this? Why is there this collective response from people?
Janae, anger is a healthy emotional response. Violence is never healthy.
Right.
And usually, you're right. Usually people say things like our thoughts and prayers, but people are saying things like our thoughts and copays. And I think that since 2020, there's been a rise in anger. And again, anger is healthy, but there's also a rise in desensitization to violence.
Yeah.
We have nonstop exposure to violent things in the media. People are obsessed with true crime. And frankly, when people hear about violence, now instead of being shocked, they're applauding. So it's really concerning. That
is the interesting thing, that it seems to be that there are some people who are applauding, or if not applauding, suggesting that they're willing to look the other way because of what Brian Thompson, a CEO of UnitedHealthcare, represents. And on CNN's podcast, One Thing, a senior contributing editor at KFF Health News said that she was not surprised by people's reactions because of a, quote, collective frustration with the industry. The real damage, real harms, both financial and medical, that people experience when insurers deny and delay paying claims. Investigators have said they don't believe that this was connected to his private life. What do you make of this? And what does it tell us about how people feel right now?
As a trauma expert, and I talk about this heavily in my book, High Functioning, there is collective trauma. You're absolutely right. The trauma from 2020, the political uprisings, the war, the violence, and the injustice. People are angry about the injustice in terms of the wage gaps, in terms of corporate greed. And this is their way of feeling as if they have some control over it by being able to voice and vent over social media. In a way, it's like a mob mentality, the comment section,
yes.
Right? People are banding together to voice their outrage. And it's okay to be angry, right? Again, anger is healthy. However, violence is not. And I think it's a combination of desensitization to violence, this kind of mob mentality, and also healthy anger. It's like a recipe for what we're seeing right now.
And it seems, to that point about the connection over it, it seems like people are yearning for community. And this is one thing, frustration with the healthcare community is one thing that they've found community in.
And they have every right to be frustrated. However, band together, do something productive, write to your legislators, right? Become a part of advocacy groups. But allowing violence to be accepted, that's not a positive, healthy way to get together.
And of course, investigators are asking for the public's help in locating this suspect. Dr. Judith Joseph, thank you so much for being on to talk with us about this today.